Hey, future nurses. Welcome to this deep dive, where we're going to tackle a skill you'll use every single day.
Every single day, that's right.
Respiratory assessments.
Yes.
We're going to be like respiratory detectives,
Exactly.
figuring out what those breaths are trying to tell us about our patients.
Absolutely.
So to help us crack the code, we've got some awesome sources.
Oh, yeah.
We've got excerpts from a nursing study guide
Very handy.
and some super detailed explanations of normal and abnormal respiratory findings.
Putting it all together.
So think of this deep dive as your cheat sheet to becoming a respiratory assessment pro.
Yeah, I like that.
All right, let's
Yeah.
start with the basics.
Okay.
What should a healthy respiratory system look and sound like?
Right, the foundation.
Our nursing guide actually points out this interesting fact about the chest.
Okay.
It says a normal chest should have like a 1-to-2 ratio.
A 1-to-2 ratio? What does that even mean?
I know, right? It makes it sound like we need to be carrying rulers around on our rounds.
No, it's all about proportion. A healthy chest is wider than it is deep.
Okay,
So, yeah, kind of like a rectangle.
gotcha.
And that shape, it allows plenty of room for the lungs to expand and take in that oxygen.
So that rectangle shape directly impacts lung capacity.
Exactly.
Okay, that's a good one to remember.
Definitely.
The guide also mentions checking for pink skin and mucous membranes.
Yeah, that's kind of a no-brainer, right?
Right, we're looking for that healthy flush.
Exactly. We want to see that nice, healthy pink color, not any bluish discoloration.
Because that pink color tells us.
That the blood is carrying enough oxygen.
Okay.
Now, if you see cyanosis, that bluish tint, that's a major red flag.
Yeah.
It could indicate that the blood isn't carrying enough oxygen, and that could be a sign of hypoxemia.
Hypoxemia, that sounds serious.
It's a condition where the oxygen levels in the blood are dangerously low.
Definitely a sign to investigate further.
Absolutely.
Now, the guide also mentions something called tactile fremitus.
Ah, yes, tactile fremitus.
As a nursing student, I remember thinking, what is that?
It can sound a little intimidating.
What am I even supposed to be feeling for here?
Well, think of it as feeling the sound waves created when your patient speaks.
Okay.
You're placing your hands on their back and checking if the vibrations feel the same on both sides.
So I'm literally feeling for vibrations.
It's a subtle assessment, but it can tell you a lot.
So if one side feels stronger or weaker, what could that mean?
Good question. It could suggest that something is blocking those vibrations, like fluid buildup and pneumonia.
Mm.
Or, on the other hand, if you feel increased fremitus, it could be a sign of consolidation in the lung tissue.
Which you might see in conditions like pneumonia.
Exactly.
Wow, so much information just from placing your hands on the patient's back.
It's amazing what you can learn with a good physical assessment.
Now let's talk about what we should be hearing when we listen to those lungs.
Right, the sounds of breathing.
Our guide talks about these things called vesicular breath sounds.
Ah, yes, the classic whooshing sound of air moving in and out of those tiny air sacs, the alveoli.
It describes them as soft and low-pitched. So I'm guessing anything harsh or crackling is a bad sign.
You got it.
And then there are crackles.
Crackles, oh yeah, those are always going.
The guide says they sound like Rice Krispies in milk.
That's a pretty accurate description.
And it says that they often indicate fluid in the alveoli, like in pneumonia.
Right, but here's the key. Don't jump to conclusions based on one sound alone.
Okay.
It's all about putting those findings together with the patient's history and other symptoms.
Gotcha. So it's all about the bigger picture.
Exactly.
Speaking of things that sound kind of alarming, our guide also covers abnormal respiratory findings.
Yeah, there are some pretty descriptive terms in there.
One that always stood out to me was tachypnea.
Tachypnea, that basically means breathing way too fast.
Right, like the body saying, hey, we need more oxygen stat.
Exactly. It could be due to a bunch of different reasons,
Right.
from fever and anxiety to more serious respiratory issues.
So again, it's about considering the context.
Always.
Another one that caught my eye was barrel chest.
Barrel chest. Now, that one sounds pretty dramatic.
What exactly is a barrel chest?
So it describes a rounded chest shape, and it happens when the lungs become chronically overinflated.
Overinflated.
Yeah, it's often seen in patients with COPD where air gets trapped and can't escape easily.
Oh, wow. So it's like the lungs are constantly inflated like a balloon that's too full of air.
That's a great way to picture it, and that chronic overinflation changes the shape of the chest over time, giving it that barrel-like appearance.
And then, of course, we've got all those abnormal breath sounds besides crackles.
Right.
There's wheezes,
Wheezes?
raunchy, and even something that sounds, frankly, painful, plural rub.
It's like a whole symphony of sounds, but none of them are the kind you want to hear in your patients.
So what causes wheezing?
Wheezes are those high-pitched, almost musical sounds caused by narrowed airways.
Okay.
Think of it like trying to breathe through a straw. You might hear that in asthma or COPD.
So are raunchy just really loud snore?
Not exactly, while they might sound similar. Bronchi are caused by mucus and secretions obstructing the airways, not just relaxed throat muscles like in snoring.
So they're like gunk in the pipes.
That often points to bronchitis or pneumonia.
Now, what about pleural rub? What causes that sound?
Imagine two pieces of leather rubbing together.
Ooh, that doesn't sound good.
Yeah, that's the sound of a pleural rub. It happens when the lining of the lungs, the pleura, becomes inflamed and rubs against the chest wall during breathing.
So it's like friction.
Exactly, and it can be pretty uncomfortable for the patient.
It's amazing how much information we can gather just by observing and listening to a patient's breathing.
It really is. It's like learning a secret language that reveals what's going on inside the body.
And the better we understand that language,
The better we can care for our patients.
absolutely.
Okay.
But it doesn't stop there.
Right.
We also need to consider how things like age, pregnancy, even weight can influence those respiratory findings.
That's a great point. Everyone's different. And those differences can affect what we see, hear, and feel during an assessment.
That's what I love about nursing. It's not just about memorizing facts. It's about understanding how those facts play out in real people.
Exactly. And those real people come in all shapes, sizes, and stages of life.
Let's dive into those nuances next.
Sounds good to me.
Okay, so we've got the basics of respiratory assessment down, but let's talk about how things like age, pregnancy, and even weight can change what we see, hear, and feel.
Right. Because like we said, everyone's different.
Exactly. So let's start with older adults. Our nursing guide highlights some interesting points about assessing those who've got a few more years under their belts.
Yeah, age definitely plays a role.
What are some things we need to keep in mind when examining older patients?
Well, as we age, our bodies change, right? And that includes our respiratory system.
Makes sense.
One of the first things you might notice in older adults is a slightly increased anteroposterior diameter.
Anteroposterior diameter, say that 3 times fast.
Right, it's a mouthful, but it basically means their chest appears a bit more rounded.
So like that barrel chest we talked about earlier.
Yeah, kind of, but not every barrel-shaped chest means COPD.
Ah, good point.
In older adults, a slightly rounded chest is often just a natural part of aging.
So it's not necessarily a sign of disease.
Exactly. It happens because the chest wall becomes less flexible over time, and the diaphragm, that big muscle that helps us breathe, might flatten a bit.
I see.
And those changes can make taking those deep breaths a little more challenging.
Gotcha. The guide also mentions decreased chest expansion and weaker tactile fremitus as common findings in older adults.
Right. That's related to those changes in the chest wall and diaphragm we just talked about.
So it's all connected.
It is. Think about it, as we get older, our muscles naturally lose some of their strength and elasticity,
Right.
and that includes the muscles we use for breathing. So you might see shallower breaths, and those vibrations we talked about, the tactile fremitus, might be less pronounced simply because those chest muscles aren't as strong as they used to be.
Okay, so if we're assessing an older adult and their chest expansion seems a bit limited or the tactile fremitus feels faint, we shouldn't immediately freak out.
Exactly. It's all about context. We need to consider the patient's age and overall health before hitting the panic button.
Makes sense. Now let's shift gears to pregnancy. Talk about a time of incredible changes in the body.
Wow. Yeah, pregnancy definitely throws a wrench into things.
I can only imagine how those changes impact respiratory findings.
It's pretty fascinating, actually.
So our guide mentions increased respiratory rate as a common finding in pregnant women.
Yeah, that makes sense, right? They're breathing for two.
Exactly.
Pregnant women need more oxygen to support both themselves and the growing baby.
Right.
So their bodies naturally increase the breathing rate to meet that demand.
So taking more breaths per minute than a non-pregnant woman.
Exactly.
Okay, now the guide also mentions something called diaphragm elevation. Is that because the baby is literally taking up space and pushing on the diaphragm?
As the baby grows, the uterus expands upwards, pushing against the diaphragm and essentially squeezing the lungs a bit.
Oh, wow.
This limits lung capacity, which is why pregnant women often feel short of breath, especially later in pregnancy.
It's like trying to breathe deeply while wearing a tight corset.
Yeah, that's a good way to put it.
Ouch. But even with all these changes, the guide emphasizes that certain findings should still be normal.
Right. Even though the diaphragm is getting a bit squished, chest expansion should still be symmetrical. Both sides of the chest should rise and fall equally during breathing.
Good to know.
And tactile fremitus should also be unchanged unless there's some underlying respiratory issue.
So that helps us rule out any potential problems.
Exactly.
Okay, we've covered age and pregnancy. Let's talk about another factor that can impact respiratory findings, obesity.
Right, obesity can definitely affect how well the respiratory system functions.
I imagine the extra weight can make breathing more difficult.
Absolutely. The guide points out that restricted chest expansion is a common finding in obese individuals.
Which makes sense if you think about the added weight pressing down on the chest and abdomen.
Exactly. That extra weight can make it harder for the chest wall and diaphragm to move freely, limiting how much the lungs can expand.
Leading to shallower breathing.
Often, yes.
And just like with older adults, tactile fremitus might be decreased in obese patients too.
Yeah, that's right. Adipose tissue or body fat acts as a sort of insulator, muffling those vibrations. So even if there's a lung problem, it might be harder to detect through palpation alone.
The guide also mentions that you might hear dullness when percussing the lower lung fields. Is that because the lungs are actually filled with fluid?
Not necessarily. It could simply be due to the abdominal contents pushing up against the diaphragm because of the extra weight.
So again, it's about looking at the whole picture.
Always remember that.
Okay, this is really driving home the importance of that detective work, especially when it comes to interpreting abnormal findings. Our guide actually lays out this 4-step process for making sense of those abnormal findings, which seems incredibly helpful for new nurses.
It's a great framework to keep in mind as you develop your assessment skills. The first step is to identify the abnormal finding, what's different from what we'd expect to see, hear, or feel in a healthy individual.
So are we noticing a rapid respiratory rate? Are the breath sounds clear? Or are we hearing crackles or wheezes? Are we feeling decreased fremitus? It's about recognizing those red flags, right?
Exactly. Then step 2 is connecting those findings to the patient's history.
Okay.
How old are they? Do they have any pre-existing conditions like asthma or COPD? Are they a smoker? All those pieces of information are vital clues that help us interpret the findings.
And step 3 is where we put on our detective hats and consider all the possible explanations for those abnormal findings.
Right. We need to think about all the potential diagnoses. Could it be pneumonia, a pleural effusion, a pulmonary embolism? We have to consider the full range of possibilities and not get tunnel vision on one particular diagnosis.
And finally, step 4 is about deciding what additional tests might be needed to confirm or rule out those diagnoses.
Exactly. Sometimes a thorough physical exam is enough to make a diagnosis, but often we need to order further tests like a chest x-ray, a CT scan, or blood tests to get the full picture.
Wow. This deep dive has been packed with information from those basic breath sounds to understanding how age, pregnancy, and obesity can influence our findings.
It's a lot to take in.
It is, but it's also empowering to think about how much we can learn just by observing and listening to our patients.
You're right. It highlights how crucial respiratory assessment is for providing excellent patient care. And remember, this is just the beginning.
There's always more to learn.
Absolutely. There's so much more to learn and explore as you continue your nursing journey.
Speaking of exploring further, I know you have a thought-provoking question to leave our listeners with, one that builds on everything we've learned, but encourages them to think beyond the textbook. What's your challenge for our future nurses?
Okay, here it is. You've learned how to identify those respiratory red flags, which is fantastic. But now I want you to consider this. How might cultural differences or language barriers affect your respiratory assessment?
Ooh, that's a good one. It reminds us that nursing is about so much more than just memorizing facts and performing assessments.
Exactly.
It's about connecting with our patients on a human level, understanding their unique backgrounds and needs, and adapting our care accordingly.
You got it. Nursing is a truly holistic profession, and cultural sensitivity plays a huge role in providing effective and compassionate care.
All right, future nurses. So we've covered a ton in this respiratory assessment deep dive.
Yeah, we really went from A to Z on this one.
But before we wrap up, let's recap some key takeaways to help boost your confidence when you're out there on the floors.
Sounds good to me.
Okay, first and foremost, remember this mastering respiratory assessment. It's like the foundation.
It's so essential for providing excellent patient care.
It's all about connecting the dots.
Yeah, seeing the big picture.
Between what you see, hear, and feel, and what's actually going on inside your patient's body.
Exactly. You got to be a detective.
Right. Use those detective skills.
Put those skills to work.
And remember those normal findings.
Yeah, those are your baseline.
That 1-to-2 chest ratio, pink skin, clear breath. Sounds
Your starting point.
any deviation from those norms, that's when those red flags should start waving.
Exactly. That's your cue to investigate further.
Yeah. And of course, we can't forget about those variations we talked about based on age, pregnancy, and obesity.
Right. Those are super important to keep in mind.
Like older adults might have that barrel-shaped chest just from aging.
Yeah, that's a normal part of aging for some folks.
While pregnant women, they naturally breathe a bit faster
Well,
because
they're working overtime, right?
they are.
Providing oxygen for themselves and the baby.
And then those extra layers of adipose tissue in obese patients
Yeah, that can sometimes make it a little trickier
to hear or feel.
to really assess what's happening underneath.
So context is key,
Absolutely. Got to look at the whole patient.
not just those isolated findings.
Exactly. Piece it all together.
And when you do find those abnormal findings, remember that four-step process we talked about.
Oh, yes, our handy roadmap.
Identify, correlate, consider, and investigate.
A great framework for accurate diagnosis and treatment.
I love that framework. It's so clear and straightforward,
It helps break it down into manageable steps.
which can be really helpful when you're just starting out.
Absolutely helps build that confidence.
All right, before we wrap up this deep dive, what's the one thing you want our listeners to remember?
That's a good question. I want them to remember that every breath tells a story,
Ooh, I like that.
and it's up to us as nurses to listen carefully and really uncover what that story is trying to tell us.
Beautifully said. To all our future nurses out there, keep learning, keep practicing, and never stop being curious.
And remember, you have the power to make a real difference in your patients' lives.
Until next time, keep diving deep.